Thank you, Kajal and Maurice, on such great explanation on TRIPS IP. I will delve into a bit about care, financing, and access to treatment, and the political means to engage in the complicated discussion of actual purchasing of treatment. It was very interesting to see that when Latin America and the Caribbean are combined in a means of what does the treatment cost. The cost per person per year is about $300. But when we see the actual cost per country, we have that Belize and the Dominican Republic have the lowest cost per patient per year, a little over 298 to 303 US dollars per person per year. But then when you see the other Latin American and Caribbean countries, you see that, for example, the one with the highest cost of first-line treatment is Guyana at about 2,300 US dollars per year, followed by Trinidad and Tobago, which is at over 2,000. So it's very interesting to see that when this type of discussions are happening concerning intellectual property and trade-related barriers to access treatment, we need to actually see a more of an in-depth scope per country, because when comprised with the Latin American region, we can definitely get sucked into the 300 per person per year discussion. Another interesting to happen in the region is also that since pool procurement happened, and when Maurice is speaking on what a regional platform will be for patent, we need to see that although there are regional purchasing mechanisms in the Caribbean region, we also have that although the same purchasing system exists, the cost per country greatly varies. It depends on cost of transportation, how much does it take, natural barriers to actually get shipment to countries, et cetera, et cetera. So it's also a discussion about country dependency on external financing, and particularly on the global fund support. We can see that in 2011 and 2012, most of the Caribbean countries were onto 75 and 100% on external financing of ARVs. Antigua and Barbuda, Dominica, Dominican Republic, Guyana, Grenada, Haiti, Jamaica, St. Kitts and Nevis, St. Vincent and the Grenadines, and most of other Caribbean countries were either 20 to 75%, and the only ones who reported no dependency in the WHO Treatment in the Spotlight report was actually Bahamas, Belize, Suriname, and Trinidad and Tobago. Most of the countries that receive global fund support for treatment, particularly Dominican Republic and Jamaica, who will see a phase out of the global fund in ARV purchases by 2015, are actually seeing that the governments need to dive into and pull in to do the country purchasing. The problem with this is, and why does this relate to intellectual property and patents, is because when talking about the TRIPS flexibilities, these countries will go into a newer purchasing mechanism post-2015. And having a good response against what might happen post-2015 in the purchasing mechanisms of each of these countries poses a big threat in the actual scale-up of treatment. How are we falling off? So strong intellectual property protection in developing countries, as we've discussed, means that people do not get medicines they need. Then the low level of knowledge on intellectual property and trade-related barriers to accessing treatment is a huge problem in demanding it. One of the things that it will be very key in the next couple of months and years is to see that the new retargeting exercise being led by the WHO and UNAIDS actually increase the scale of access to treatment by the famous 90-90-90. And that 90-90 means, 90-90-90, means that 90% of the people, 90% of the persons that are living with HIV need to be tested. So we have that first 90 there, then out of that, the next 90, we have to have the other 90% of the people that tested positive to be linked into care, and then out of that 90%, we have to have 90% of people living with HIV that are undetectable viral load. The issue here is that coming into this exercise, the differences between Caribbean countries in the way that the purchase mechanisms are happening and the cost that they incur means that the scale up of treatment will actually mean that if we don't squeeze out ourselves TRIPS flexibilities in this process, we will see that the scale up will not only be very difficult, but it will also be very costly. when conducting the exercise done on the retargeting in Mexico City in May this year, we noticed that although some countries in the Caribbean don't use model data as some other countries around the world, we see that the increase is something that will be very difficult if the funds are not allocated accurately, and not only that, if we continue to promote intellectual property rights within the Caribbean region. And what can be done? When having this discussion and seeing what Kajal and Maurice presented, there's a very big area. There are three areas that are very important to start promoting within the region, which is one, resource mobilization. An important case needs to be made at a regional scale on the importance of treatment scale-up and the barriers that patent laws present in the different countries, in the different territories and countries within the Caribbean. The interesting thing is that when the Caribbean context gets sucked in with the Latin American context, there is very low level of resource mobilizations because of the numbers that the Caribbean present. Although the Caribbean is the second most affected region in the world by the HIV, when agencies and donors take care of the numbers by themselves, the population of people living with HIV in the Caribbean is about 250,000 people. So when you divide that between all the Caribbean territories, you see that although most territories are of high prevalence, the numbers of people are very small, but that does not mean that the people need access to treatment. So there needs to be a case made in the region and in different territories and countries within the region to actually notice that if we don't take care of this now, post-2015 will be another difficult topic to handle within the region. Also, we need to talk about community systems capacity. When envisioning the CSS model and the community system strengthening model that is going on with the Global Fund, with the resource mobilization should come the strengthening community system to understand how the purchasing is happening in each country and how does the health systems function. When carried out a couple of in-depth interviews in Dominican Republic and Haiti, we noticed that although we know that treatment is something that is needed and that needs to be purchased, the way that the treatment flows within the health system in each country becomes quite vague. It mainly depends on who is purchasing what and when, and if the treatment on first line is available or not. So sometimes the stockout processes, when there are stockout episodes in the countries, we don't necessarily know where is it exactly happening. If it's happening at a pharmacy level, or is it happening at the stock center of the country. So that is also, we need to further engage communities and health systems together, which I know is part of the difficult discussion of actually bringing communities and governments together. But it's very important to understand how the purchasing mechanisms function in order to determine where are things failing. Is it the patent? Is it the issue with the patent in the country, or is it a problem of purchasing? And next, with the community systems capacity, we need to actually do the advocacy needed to work in the different problematics that are happening currently. So it's very interesting to see also how the global perspective, when it comes to such big generic producers as Brazil and India, become examples of what can be done in the region. But the fact is that given the big burden in the small number of people living with HIV, when compared to other regions, the case needs to be made also in a financial system perspective. Sometimes when addressing health ministries, they're concerned about the finances. We may speak about human rights, and people for some reason don't necessarily answer, but we need to talk about also treatment sustainability. So these are just three key areas that we can discuss further in the Q&A to see how we can further engage the communities around the Caribbean to start a discussion and to continue the discussion on what can be done post-2015. Yeah. So now is the way forward.